Hi, I'm Dr. Burt Webb. I'm a board-certified OBGYN that's been in practice here in Scottsdale, Arizona for just about 35 years now. And I want to talk to you a little bit today about the ablation procedure. It's a wonderful procedure. I really went into obstetrics and gynecology to help women, and this is one of those procedures which I think is a wonderful procedure. It's one of the nice things that I can do for women. Women have periods every month, and it's a hassle. I would not want to have a period. And some women not only have a period, but have really just flooding, and they can't function, they can't take their kids to school, they can't go to work. They're just miserable with the bleeding that sometimes is very heavy. But whether the bleeding is very heavy or even if it's not that bad, it is still a hassle. And the ablation procedure can very easily eliminate or decrease the amount of bleeding. So with the techniques I use the two best techniques to accomplish this. And we have about a 90% success rate at either eliminating the periods or stopping them very significantly. The procedures are done here in this room with this equipment. It's very simple. It's like a pap smear. And then I put one of two devices in the uterus, and I cauterize the lining of the uterus so that it doesn't grow back. This lining is the material that is shed each month. And by eliminating that, then we eliminate periods. Well, I wanted to show you some of my equipment that I use when I do ablations and the Essure procedure. And the reason I want to show you is it really lets you know how simple this is when we do it here in the office. So here's my speculum. I use smaller than normal ones. You see it's a little bit wider than my finger, but not as thick. So it doesn't matter. But even though the patient's asleep, I still like to cause as little discomfort as possible. And then this is the laparoscope that I use that goes up through the cervix. And then there's a camera on the end that I look through, and I visualize the cavity. And if I'm doing the Essure procedure, then I will simply place the plug in through here and put it into one tube, and then I move over and I put another plug in the other tube, and then I take this out and we're done. It's that simple. It's really very simple. It does not take me very long, and that's why there's no discomfort, because you see there's no scissors, there's no needles, there's no suturing material here. It's just that simple. And if I show you the size of my pen as compared to the scope, you'll see that the laparoscope is not very big, and so there really is very little discomfort when we're doing this procedure. So it's done very simply. Insurance covers it. There's no incisions, there's no suturing. It does not affect hormone production. It's a very simple procedure. It takes just a few minutes. People come in, they leave, they need someone to drive them home, but they're here for a total of about 40 or 45 minutes, so it does not take a long time. They can have some bad cramping for up to 6 hours when they go home. Some women have very light cramping and just take Motrin. But then they tend to go to sleep at night, and they wake up the next day with this very light cramping, either returning to work that next day or the following day. So it's a very well tolerated procedure that is done very simply, and for the rest of that woman's life can either eliminate or significantly decrease her bleeding. It's a really, I mean, I have to tell you, my patients that have had this done all say, I wish I'd done it sooner. So you should consider the ablation technique. And the way that we do it here really makes it very simple. We do a lot of these, so the whole procedure of checking in, dealing with the insurance, which my office does, having the procedure done and leaving is very simple. Leave it up to us. We do a great job at ablations.